Hey guys, it's Ray Lynch, physical therapist, and here with Aaron Fick again. Aaron, I'll let you kind of introduce yourself, just with this being our second one. But we've got a couple topics we wanted to discuss with you guys today, and get your feedback, and we'll go from there.
Yeah, so Aaron Fick, certified strength and conditioning specialist, is the title, and moved from the performance sector now into the clinical sector.
So, guys, there's a couple things that we kind of on the docket for today that we wanted to talk about. Aaron and I kind of text back and forth and trying to figure out, what would we like to discuss? Professional to professional. And I actually, Aaron, the very first thing that I wanted to discuss was this notion of creativity, or not necessarily even the creativity of it in the fitness world, but when individuals are going into the gym and they have a new workout every single day, some of the things that I've heard is, well, we need to shock the system. And obviously I have my own bias for people coming off of injuries that I'll kind of talk about in a little bit, but I just wanted to get your perspective on this notion of creativity or shock the system, or just kind of not being, what's the word? I guess not being structured to some degree.
Sure.
I'll just kind of let you take the floor on that, and we'll go from there.
Yeah, so shocking the body is a good way to throw it out there. A lot of times synonymous with like muscle confusion, and
Sure.
you gotta keep the body guessing and all that, and that's actually not the route we want to take. So if we're constantly making the body guess and we're being unpredictable with the body, that's where we can have unpredicted injuries.
Touche.
So with that, there does need to be a balance, as always, because before anything, before any science, before any established exercise can happen, you have to have compliance, right? I can make the perfect workout, but if the patient doesn't want to do it, then what's it matter? So there is this balance of creativity and still being organized, and there's also still the shock factor that can definitely be in there. But we've just got to take these polarized areas, and we can still have organization and structure to them.
Yeah.
So essentially, when we talk and hear about shocking the body, muscle confusion, switching things up, all we're doing is never establishing. We're not establishing a process for the body to develop on, right? So in order for the body to develop, in order for us to get better, we have to make stepping stones, right? And these stones have to be one in front of the other in order for us to go forward. When we shock the body, right, we do one particular exercise, and we set that stone. And then the next day we do something completely different. It's like, well, yes, you put a stone down, but it was way over here. So we didn't take a step forward. We didn't take a step in any direction. And we're just kind of hopping around, hoping that we stay on these steps without falling in the water and getting injured, right? So constantly switching it up doesn't allow for biology to take place. Stress recovery adaptation is a actual quantified process that we have to follow. Now, with that, like I said, compliance is number one. So I'll just take us through kind of how, if I were to have a beginner athlete come to me, or a first-time athlete, patient, client come to me, how I would set it up. And creativity and compliance comes with a lot of conversation with the client. So I'll ask them what they're comfortable with doing right now, where they are, where their interests lie, and that is the foundation for the workout. Now, they give me what they're interested in, like, hey, right now I'm only comfortable with machines. I've got a membership just to Planet Fitness. Hey, that's okay. I can work with that. Or hey, I only have TRX straps, something like that. That's completely fine, right? I'm not trying to build Rome in a day. I'm going to start with where I'm at. So I'll collect this information from them just through conversation, and then we'll sit down together, and I'll actually build a workout with them. I'll actually sit down and be like, hey, I won't give them the details, right? I won't overload them with anything. I'll just lay out like a week layout in terms of this is what a few days will look like. I won't really go into the whys. I'll just be like, hey, this is what I think your workout should look like for the week. And they'll be like, okay, cool. Then I'll talk to them about, are you comfortable with these exercises? Are you comfortable with this? kind of going back and forth there. And then essentially with some more conversation, we'll kind of bless off on what a week looks like for them.
Yeah.
And again, not giving them a whole lot of detail or not any more than they're interested in. But from my perspective, I see that everything's pretty organized. Is it a perfect workout? No, probably not. We're sticking with what they're comfortable with. I would like to get everyone to the barbell, right? But maybe this workout has no barbell movements, and that's okay. But the most important thing after I get their blessing, if you will, on that first week, is that's all they'll be around for. Like, okay, cool, thanks. Appreciate it. Get to work. And then my end, when they're not around, I'll create a progression off of that week. So
Gotcha.
they'll essentially repeat that week for several weeks at a time, like 2 or 3 weeks. They'll do the same exercises, but there'll be a progression with it, whether that's sets, reps, weight. There's a lot of factors that will determine that, but there will be a quantified progression for the next several weeks. And this is good for them because it allows them to start at their own pace. They're doing what they're compliant with, they're doing what they're confident with, and the creativity part was all based off conversation.
Sure.
Now, after that first month of training is done, they've got their feet wet, they're feeling more confident. The creativity will take 2 routes. One, it will take a route of trying to, again, this comes with a lot of conversation, trying to get them to the next exercise. Like, hey, you're doing pretty good. Let's take the next step. Let's go to a dumbbell, or let's try this barbell exercise out. We'll start adding in some quote unquote intimidating exercises.
Yeah.
And then again, we'll develop the next month, and then we'll develop that week layout again, that new week out with new exercises. But again, with their comfort level, I'll put a progression behind it for the next couple weeks, and we'll just repeat this process. Now, eventually, that's with the beginner, right? And we're just kind of going off their comfort level and then just chipping away at their comfort zone. Now, eventually, with my high-end athletes, they'll come in, they know what they're doing. It's like, look, right, we got to squat, we got to deadlift, we got to get the bench down. We'll talk about how we want to do this. This conversation will be more of me explaining to them why my setup's this way, because they're engaged, there isn't a compliance issue, anything like that. But same thing, we'll set up a week together, make sure that they are 100% on board with it, they have confidence with it, because that's A1 priority for me. They need to believe in what I've built for them. I'll send them away. I'll develop a progression for the next couple weeks. They'll execute that month of training, and then where it's still creative, but it's creativity with some progression to it still. So what I mean is the next month of training they'll come back to, and we'll make adjustments based off of the most recent training history. And that's a huge underlying theme for everyone's training is the way that the training changes is based off of the most recent training history. So this athlete was kind of struggling with their squats at a particular movement. So the next month in training, we implemented, instead of a high bar regular squat, let's say, we implemented a high bar squat with a pause in the bottom. So now he's went from high bar squats to pause squats, brought a little bit of variation in there, but the variation was applicable to his need. Added some creativity, if you will, added some spice to it. And then usually my higher end athletes, they like to feel like smoked, if you will, at the end. And that's too easy. We'll incorporate what I call finishers into a workout. Sure. So whatever the priority of the day was, they'll knock that out. But then the last 5 minutes will be like, hey, 5 minutes, give me as many yards as you got on a prowler at 200 pounds, or give me air squats, 30 seconds on, 30 seconds off. Just to give them that feel of like, hey, I'm smoked. But in reality, 5 minutes is some consistent work.
It's not going to overload them like crazy, but makes them feel good. But I think it really goes back, though. So we were kind of sending this out to some PT students. Any of the PT students that just listen to Aaron talk, this guy just laid it out in detail. If you ask a strength and conditioning coach, how are you laying it out for your clients? And I've heard this, and you've heard it. Man, dude, I just can't. I just made it up on my way in, man. I just made up the workout on my way in. I'm like, are you kidding me? But and they'll throw out, I'm a CPT certified personal trainer. I'll throw out this and throw out that. And, it goes back to your stepping stone analogy, though, is the fact that, can you be creative? Absolutely, you can be, but you have to have the foundation to be creative on. You can't just say, well, you can't really do a deadlift, or we haven't really gotten there, and now I'm just going to go ahead and throw on a million different things or throw this variation because it's going to make a sale. And unfortunately, I think that's where, I think your method is definitely the one where, I wanted to get on to talk. We're going to talk a little bit about, guys, what my basically perception is with individuals coming off of injury, what I like them to do. And that's exactly what if I were to have the conversation with Aaron and he said this, and I'm like, dude, you can have all my patients. Like, if they want to do barbell and you get them to barbell, that's fine. Like, if they don't want to do it, I think it sounds like you've got at least a system set up to change it within the means and not overload the tissue just for the sake of, well, we're going to overload it today. I think as a therapist, and, I was, a personal trainer for a little while, I made that mistake, right? You're driving in and you're like, oh crap, I forgot to really think through this one. Like, as a personal trainer, like, I'll just come up with some stuff and maybe some box jumps and maybe this and maybe that. And we've all been there where we've made mistakes, but I think the reality is, guys, you have to hold yourself to a higher standard, and you have to hold everyone to a higher standard, especially, for you guys who are PTs and students. You have to hold, these people that you're sending your clients to. Or if it's you, Aaron, and you're like, look, my colleagues, like, we all have to hold ourselves to a higher standard. Like, being okay with just, well, I'm just going to sweat a lot and I'm going to feel like I got a really good workout isn't enough. It needs to be, well, it's structured, it's progress in an appropriate manner. And I love that you laid it out that way, because it's like, well, for my beginners, here's what we do, here's where we start. And I think that's awesome, because when it comes to injury and injury prevention, I know with the CSCS material, it goes through like, hey, if you go up this much from a percentage of volume standpoint, you have this, they give you kind of like a injury risk or re-injury risk and things like that. I think regardless, for me, it's just keeping it objective, right? Like, if I can't, like, I'm all for creativity too, like to some degree, right? So within a certain limit, right? So the EMOMs and everything else that people are doing, fine, AMRAPs, all that stuff, that's great, as long as there's a foundation with, right? And I think just going in and blasting through those things all the time, I think, can sometimes lead to injury. But I like the idea of just being objective. It doesn't mean that I'm against EMOMs and AMRAPs and things like that. Like, absolutely not. I mean, as long as if you want to challenge your body and challenge yourself and beat a time, like, awesome, go for it. As long as you have the foundation to work from. That's really it, guys. From an injury standpoint, they're coming off of, say, a microdiscectomy, and they're working with us in the clinic, for several months. Well, by the time they get ready to go back, and there are people who do want to go back and do some lifting. And now their surgeons, depending on the surgeons, will say, well, you'll never lift again or whatever. And we'll get to that in a minute, but because that drives me crazy. But you want someone like Aaron, you want someone who is going to progress them appropriately and objectively and do it safely. And you want that person in your corner. So, guys, that's my biggest takeaway is have these conversations, right? How do you progress your clients? If I send you this person, what are we going to do? So I think that's great, man. I think that answered my question as well. So it's awesome.
Definitely. I think as your experienced coaches, 10 years, over 10 years now of training, essentially a good coach has his own manual, right? Like, I'm not just like making stuff constantly up for each individual. Like, I'm pulling from my own, if you will, textbook of collected knowledge, and everything has, because I've done so many thousands of programs, I'm not constantly like reinventing the wheel. People think like, oh man, this must take you all day long. It's like, well, no, it doesn't, because I've had so much repetition. Everything is slot based, right? So, and that's great, because when you have slot based training, if you will, from a coach's perspective, I can have a ton of creativity. I can almost, the CrossFit athlete, the one that just wants to come in and hit the wad of the day, I can go so far as to have the CrossFit-esque workouts and still have a progression just because of my ability to have a slotted program design. You know, you're going to do this, you're going to do your AMRAPs, you're going to do your EMOMs, you're going to do your time stuff, and we can even combine different training aspects, what the literature calls concurrent training, where you're mixing strength training with endurance stuff and things like that, and that all can be done. Yeah. If you do it organized, exactly. Right? It comes down. Exactly. It doesn't come down to these hard lines of like, oh, you can't do X with Y. No, it's not about you can't do X with Y. It's about you have to do X and Y in an organized manner. You can't try to make X fit into Y, and you can't try to make Y fit into X. Yeah. You could do everything. You just need to be organized with it and create that progression. So it's definitely creativity has never been. I've never lost a client due to, oh man, I'm bored, right? Because one, nobody gets bored of games. Nobody gets bored when they see progression.
No, so guys, so Aaron's no longer in the Columbus area, but I have actually worked with some of his former athletes, and the number one thing that I hear is, I don't know that I've had more gains, and I'm just going to go ahead and stroke your ego real quick. But he's like, I don't know that I've had more gains with Aaron. Like, man, I hit a PR on deadlift, or I hit a PR on this, and this is important to certain people. And I mean, I think it goes a long ways as far as just from a psyche standpoint, but a physical standpoint, goal setting standpoint. And yeah, like you said, man, you haven't lost anybody due to what we would say lack of creativity, right? I mean, it's organized. People are hitting, exactly like you said, if people are getting their results, they're fine with it. And you're like, dude, I'm great with it too, because I'm a coach. I'm keeping it organized, and you're hitting your gains. So yeah, I 100% agree with you, man. And I've heard that from at least 3 people in the last 2 or 3 months who have said, awesome. I was stronger when I worked with Aaron. So there you go. There's that little feel good for you for the day.
Definitely, that helps the motivation. But it's also important, you know, when people think program, they think of, oh, that's just for numbers chasers and things like that, and performance athletes. It's not. It's a much healthier mindset from a psychosocial standpoint. When you have, I mean, this is for the psychologists out there. When you have micro goals, when you have things, there's this popular term out there, SMART goals, specific, measurable, attainable, realistic, time bound, right? That's what a program creates for you. When you have micro goals day in and day out, you're no longer like stressing yourself about, oh man, I'm out of shape. Oh man, I need to lose body fat. Now you're in a healthier state. Hey, I need to get to sleep on time because I need to train. Hey, I need to eat healthy today because I need to train, right? It's hard for clients to be like, oh, I need to eat healthy just because I need to eat healthy. Yeah. It's arbitrary. But when you have reason and purpose, and even if you don't care about performance, when you have these micro goals, you're going to sleep for a reason, you're eating for a reason, you're paying attention to portions for a reason. You know, you're bettering yourself for a reason. And that's the true purpose of a program. It's not just performance for the performance athlete, it's performance for the psychosocial factors as well.
Exactly. You brought up psychosocial, so we're going to go ahead and let's just move on to that next topic. So, guys, what we also wanted to discuss is this notion, and Aaron, you and I have gone back and forth on this before. Oh, yeah. And I think we're relatively on the same page here. Mm-hmm. But maybe I think we could shed some light within the 2 separate professions on how we may or may not contribute to this. So what we wanted to talk about, next, guys, is this notion of nocebo, right? So basically harmful language. Now, if you're a PT student or PT, it's like, yeah, I've heard this before. Imaging, some imaging is bad and not useful, and they use terms like degenerative disc and degenerative joint. Well, I don't really want to talk about that because I think we've heard that a million different times, right? What I want to get onto is talking about this notion of even taking the biomechanical approach, or explaining basically the situation, the injury, whatever it is, to the patient in a biomechanical manner can sometimes be harmful. So we'll talk a little bit about the biopsychosocial approach in physical therapy and then in the strength conditioning world. And then the other thing that I wanted to talk about is not necessarily just harmful words as it equates to those kind of things, but recognition of individuals who you have to apply this biopsychosocial model to. Mm-hmm. If you give them biomechanical, they are going to falter, and they're going to increase stress, increase fear, And then you actually unintentionally have sent them down the wrong path. So what I'll do, man, is I'll kind of let you say a little bit on that if you want to, as far
Yeah.
as how you've seen it encountered in the strength and conditioning world. Maybe even some, I know I have two examples where I have faltered in this in the past, and I think we all have to some degree. But I'll let you kind of take the floor on that and just kind of give your
Absolutely.
perspective.
Yeah, so it's important when we talk about this stuff that this is where I really need to, and when I say I mean also people like me need to stay in my professional lane, right? So I am a strength and conditioning coach. I'm not a medical professional, but just to give a crude overhaul of biomechanical versus biopsychosocial from a strength and conditioning non-medical perspective. The biomechanical standpoint is something I try to shy away from in the strength and conditioning world. It's essentially, again, a crude understanding of it is, hey, front squats are heavier stress on the knees, therefore front squats are worse for your knees. Deadlifts are stressful on the back, deadlifting is worse for your back. Biopsychosocial takes into consideration, hey, your expectations of this lift that you're about to perform are going to determine how you feel from it, right?
Yeah.
And it's important to understand this because the biomechanical model, in the crude sense that I just put it in, sounds good on paper, and it gives coaches a lot of things to, like, hey, do this to fix this real quick. Hey, this exercise is going to fix this problem. Hey, this exercise, it's a reductionist view of taking, a exercise to fix a problem.
Sure.
And that's inappropriate on a strength and conditioning specialist to do that, who's not, obviously medically qualified. But two, when it comes down to reality, that crude understanding has never lined up in my 10 years of experience. I've had athletes who have more pain back squatting than they do front squatting, even though front squatting is harder on the knees. I've had athletes who have back pain when they squat, but not when they deadlift. I've had athletes who can bench press really heavy, the shoulder killer, but they can't do a friendly push-up. This reductionist view doesn't line up with reality, and there's just too much variation to make broad statements of, hey, you need to stay away from this exercise, or hey, you need to do this exercise. And expectations really set the tone. If there's one thing that we have a lot of evidence on when it comes to injury in my field, is what we call the internal loading, which we touched on before, where how the athlete's feeling that day and what their expectations are is what's going to lead to injury. I will never have an athlete attempt something if their confidence isn't there.
Yeah.
Even if I know they can do it, if they're not prepared to do it, they're not going to do it, because their potential for injury is going to go through the roof.
Yeah.
That's a biopsychosocial issue, not a biomechanical issue, right? Because if I took on the biomechanical approach, hey, X, Y, and Z is lined up, you can execute this, right? But then they get under it, and what happens if they get injured? So again, very crude, but it's very strict to my side of the house, and I don't stay true to a biomechanical approach. I think it's unhealthy for the athletes and the clients, and I don't want to go down that road of trying to be that salesman of, hey, I've got all these plethora. It leads too much to exercise variety rather than the focus of progression in biology. So
No, exactly.
that's my standpoint.
No, and I think the one thing you said, though, it's the expectation of any particular intervention, whether it's in the strength and conditioning field. So a deadlift is going to hurt my back. So if I do a deadlift, I'm going to hurt my back. It's an expectation, basically creating a reality, right? I mean, it's feeding right into it. One of the things that we look for, right, we get people who come in, whether it's acute pain or chronic pain, and from a biopsychosocial standpoint, we want to really look at these what we call yellow flags. So fear avoidance, you're looking at stress, anxiety, depression, and all of these other things from the psychosocial standpoint that, quite frankly, I think a lot of PTs would say, well, I can manage that, right? And I basically got a rude awakening. I had a patient in my residency that my mentor was like, you can't handle this aspect. You are not the one-stop shop. Who should
Sure.
you be referring to, right? He's like, you can change the way that you would approach maybe this individual with chronic pain or individual with pain in general. And maybe you change the way you word things, or you make sure that you may take a different approach. But sometimes it's not even up to me or you. And maybe we have to refer to another kind of clinician to make sure that that's taken care of. So
Right.
first and foremost, I think it's the recognition of fear and anxiety and depression and all these other things that I think any field needs to consider. But also from a biomechanical standpoint, guys, so this is more specific to the PT students, because I know a lot of you guys are about to go on rotations, which I think is why this is actually really perfectly timed talk. You guys are going on rotations in the next month or two. For those of you going into second or third year, depending on your programs, you are knowledgeable, but also understand that you have knowledge deficits. And when you go in and you're speaking to these patients, you are doing it with good intention. I get it, because I've been there, I've done that, and you want to explain to them why their shoulder hurts. So you start throwing out all these medical terms, right? Well, I think it's impingement. And basically what's happening is this is coming down and this is doing this. Well, some people, if you haven't identified the fear and anxiety and everything else, you are making that pain worse. And we won't go into detail on that, because we could go down a rabbit trail for
Sure.
another hour. But I think that's the biggest thing that I noticed when I was a student, is this notion of having or wanting to basically explain it from a biomechanical model and say, oh, well, this is what's going on, yada, yada, yada. The other thing, guys, when we just kind of threw out the term at the very beginning of this discussion, nocebo, right? So basically words that do harm or have a negative effect. And Aaron and I in our previous conversation basically discussed that there's either nocebo or placebo. There is no Switzerland. When you go out, I mean, there's just not. There's no
Right.
neutral. And when you go out and you're talking to patients, and I'll give you guys an example. When you go out and you're talking to patients, you have to be really careful and choose your words. And also, this is a different circumstance where not just explaining the scenario or explaining the injury to the patient, but actually getting in a disagreement with another medical professional was actually harmful for this patient. So, Aaron, I had this lady, she had a total hip replacement. I can see it clear as day. I was working up in Atlanta, and she had this hip replacement by a surgeon that we worked very closely with. And the PA, basically she was having complications. She was 2 or 3 months out, and she was having some pain coming down the, anterolateral aspect of her leg, and then it was kind of more anterior, and then she started having some groin pain, and all things all over the board. And so she goes back to her PA. She hadn't seen me until after. She was going somewhere else for physical therapy, went to her PA, and the PA comes in and says, well, that's a diagnosis of sciatica. I said, well, the sciatic nerve isn't even on that side, is what I'm thinking.
You got to step back and she just had a hip replacement.
Yeah,
That's what it comes to.
Yeah. Well, and that's when I'm sitting there and I'm like, God, she just had a hip replacement. It's not sciatica. It's not even in the back. She's not having any of these other symptoms. I was a third rotation student. So here's what I did that was stupid. I said, well, I think your PA is wrong. Now, guys, yeah. And so quite frankly, now I can say
That made it awkward.
Maybe do what?
I said that made it awkward.
Well, not only did it make it awkward, guys, but it made it worse for my patient. What I failed to recognize was that my patient was anxious because she didn't know what was going on. She was fearful to put any weight on that hip because she thought it was going to break. And C, she was depressed because she thought that this was going to be a relatively clean procedure and she was going to get back to everything she needed. So what did I do? I just fed into that fear and I fed into that stress by saying, that PA that you trusted, well, they're wrong because the sciatic nerve isn't even on that side. I did not do anything for myself. I did not do anything for that PA. The only thing I did was harm that woman. And I tell that story to the students all the time because whether you think you're right or whether you think you're on the right track or whatever, guys, understand that when words come out of your mouth, it has an effect on your patient. And you've got to understand, like in that scenario, if I could go back, I would have never said that to that lady. We would have kept treating and said, oh, okay, well, that's fine. And maybe me and the PA would have had a conversation. But quite frankly, we could have kept doing our same plan of care without, going crazy and saying, hey, yeah, your PA is wrong. Like, this guy's not helping you at all. All that did was harm the patient. And I think that's one thing that we have to be a little bit more careful of is not getting into this. Well, I know what I'm talking about. There's a great graphic here, and I'll have to, if I can find it, I'll pull it up. But it basically talks about XY graphic, right? So just a line graph, and it talks about the level of knowledge and understanding of knowledge deficits, or basically confidence and knowledge is what's on the X and Y axis. And at the very beginning, your knowledge is like super low, but your confidence is like sky high. Because you're like, I just got done with the DPT program and I know everything. And guys, I'm only 2 years out, so I've got plenty of knowledge deficits. I do not know it all, but I do know where I was at. I mean, I thought I was the best thing since sliced bread. I was like, man, I could treat circles around half these people already. Being ignorant, right?
Sure.
But this graph is high on confidence, but you're all the way over here on knowledge. And then as you get a little bit more experience, you realize, holy crap, there's a lot more than I need to learn. And I think, guys, especially when you're here, so confidence is super high, knowledge is relatively low, right? It's not that you guys don't know what you're talking about. This isn't you, Aaron, just PT students going on clinicals. It's not that you don't know what you're talking about. You have great knowledge, but understand that there is a lot to learn, and you really have to be careful about some of the things that you're saying. So that's my biggest point on that, man, from a nocebo and even placebo standpoint. I think we just really have to, in both professions, be careful what we say, because I think some people have used it almost as a sales pitch and said, well, here's this, and hey, man, and you see this all the time in other professions as well as in PT, is, you know what, your hips are like way off. Like, I mean, I haven't done anything, no imaging, anything like that, but your hips are way off, and I'm pretty sure this is happening, and this is rubbing up against this, and your ankle's doing all these crazy things. Like, sometimes those patients don't need to know all of that.
Right.
And you don't need to sell them on everything like that. I think sometimes understanding, saying, look, I know you have some hip pain. There's a couple things that we identified today during the examination that I think as we start to address them will help with your hip pain and help you get back to better function. There's no need to throw out all those terms just to make yourself look better. And sometimes those terms with good intentions end up being harmful. So that's my soapbox, and I'm going to step off of it.
No,
but
that's I mean, it's the same issue on my side of the house is everyone wants to show off their complexity to what they built, but it's not complexity. It's the power behind the throne. The complexity is on my end in what I do, and how I present it needs to be as simple as possible, because
Sure.
the more, and even if there's still complexity, the more simple you present something, the more effective you can have that client and patient respond, right? If you can just get their focus and just get them to drive in, the more simple it is for them, the more potent response that they can have, the more emphasis and drive that they can dial in and focus on. So, I don't ever, because we both know certain coaches that like to show off the dazzle and complexity to what they do and use the $5 words, but it's pointless and confusing, and brings in doubt and brings more questions, and then people end up not knowing what they're doing.
Yeah. So. Well, and I think it creates a reliance, and
yes.
And quite frankly, I think that's from a PT standpoint and from a medical standpoint. I mean, if we're just going to paint this with a broad brush, I would say that we need to get away from really identifying and highlighting all these faults and making people think, oh my gosh, like I'm going to be broken the rest of my life unless I do this shoulder exercise. Like, oh my gosh, like my rotator cuff's just going to be a mess unless I do this exercise, and I've got to do it, and I've got to keep coming back to this guy. I know a guy who was at a certain medical professional's office for 6 months with no improvement. There's no reason why you should have no improvement over 6 months. He should have been referred out or changed plan of care at really 2, 3 weeks, even 4 weeks. And I think that's kind of where it's ended up, is we've created this reliance by throwing out buzzwords, like you said, by throwing out medical terminology, and we've created harm more than we have good, and some with good intentions, others with sales pitches, trying to get it from that standpoint. But I think it's just gotten to the point where, you and I have definitely had the passionate conversations, and guys, this is pretty much what started us wanting to talk about really having a podcast at all, or having any kind of video. Are we the two most qualified individuals out there on the internet? No, absolutely not. But we have you've been in the medical, or you've been in the fitness field at least for over 10 years, and you've been a strength and conditioning coach for quite some time. Aaron has extensive knowledge. I went and got my doctorate, did a residency in orthopedics, and does that make me the most qualified to sit here and tell you what to do? Absolutely not. But I think to share our lessons and to share our perspectives to help, and then you can shape your own perspective from that, I think is important. So, man, this is, as always, a lot of fun. And it really just kind of helps just bounce the ideas off of, and I think you guys, what you'll see is that Aaron and I, even though we may be in two separate fields, there are some similarities, right? I mean, we talking about nocebo, talking about placebo, talking about expectations, things like that. And I think once we start to correct those as a society as a whole, I think we'll really get somewhere. But we're just trying to change a couple people at a time, and maybe it'll go from there. So.
I think the biggest thing I can if I can sum it all up, the one thing, if there's nothing else that anyone heard out of my mouth for the last 35 minutes, is sometimes you need to step back and you need to realize, like, the ultimate goal is to take away pacifiers, not add pacifiers. Yeah. So if after 5 months of somebody training with me or going through rehab with you, if they're doing more additional things for all these quote unquote problems, then are we helping, or are we adding to the problem, right? Are we trying to move away from the pacifiers and bring them more independence and resilience, or are we trying to pile onto their issues or lack thereof, right?
Yeah. No, exactly. Or create issues. Yeah.
Right.
Well, shoot, guys. Well, I think the next topic, so Aaron and I kind of posted on your Facebook about this today, but this kind of notion of core stabilization and things like that next time, I think, would be a really great topic for us to discuss, because I think we do find ourselves on a little bit of different sides of the fences. I think as we discussed before we started recording, I think we'll find that we agree on some things and most things, but I think the disagreements would be kind of fun to hash out and just see kind of where we go. And I think it's always good to have different perspectives. If you have a bunch of yes men or yes women or people who agree with you, then you're never going to grow. So I think next time, guys, we just go from there.
Yeah. All right. Awesome, man.
All right. We'll see you.